As the climate crisis unfolds around us, it's normal to get swept up with feelings of anxiety, despair, fear, or even numbness. Our relationships with nature and with each other are changing as environments change around us, affecting our health, well-being, and identities. The themes we'll be covering today around eco-anxiety and climate mental health are heavy subjects. And as with anything related to our health and well-being, they are likely going to be experienced differently by everyone. We'd like to give everyone a moment to reflect on where they're at and offer the assurance that the more we seek to demystify and talk about our climate emotions, the more we can work towards collective healing and action. Hi everyone, and welcome to episode 6 of the BMSC Climate Action Series. In today's episode, we're going to be exploring the themes of eco-anxiety and climate mental health. It's my pleasure to introduce our first guest today, Gabrielle Gelderman, a third-generation settler born and raised in Amiskwichi, Wissahickon, otherwise known as Edmonton. She worked for years as a climate organizer and environmental educator on Treaty 6 and 7 land before becoming immobilized by climate anxiety and grief. Finding the political and scientific frameworks of meaning insufficient in the face of such an unimaginable crisis, Gabrielle turned to spirituality and found herself going back to school to become a chaplain. While pursuing her Master of Theological Studies at St. Stephen's College, Gabrielle spent a year conducting research on climate grief with young climate organizers, and now works as a chaplain in both hospital and social movement settings. So we're so glad to have her with us today. Thanks for joining us, Gabrielle. Please go ahead and start your presentation.
Thanks, Neri. Hi, everybody. My name is Gabrielle, like Neri introduced me. I'm very happy to be here. And yeah, my presentation, I'll be drawing on some of the research that Neri mentioned I did over the past year about climate grief with climate activists and organizers. And so today I'll go through what is climate grief, what is it, what's the definition of it? Second, what does it actually look like? And third, how can we heal from it in a group setting? So my working definition of climate grief is that it's a natural human response to the losses that we experience and anticipate as a result of the climate crisis and the systems that cause it. It's a bit of a run-on sentence, so I'll break it down. It's a natural human response. I think sometimes climate anxiety and climate grief can get presented as something bad, something wrong, something we need to get rid of or get over. And I think of grief, especially as a chaplain or someone providing spiritual care, I think of grief as a really natural, healthy human response to loss. It's something that we've adapted to do, and it actually helps us deepen our connection with ourselves and with each other. So grief is a deeply important and life-giving thing, even though it's very hard. And it's a grief response to the losses we experience and anticipate. So in the context of the climate crisis, there's of course tremendous loss that's already been experienced, but so much of it has yet to happen. And this is an important distinction because we can acknowledge that some people have experienced the direct impacts of the climate crisis already. So somebody who lost their home in a wildfire or is displaced due to rising sea level is going to experience a very acute and often traumatic form of grief, whereas someone else who's maybe more insulated from some of those direct impacts, at least right now, is still going to experience loss. So you could think of a young person who is deciding not to have children in the future because of what they anticipate is coming. both the young person is experiencing a form of grief. It's different than the person who might have lost their home, but it's just as valid as a form of grief. I think that's really important to acknowledge. And thirdly, this grief is a result of, or these losses, are a result of the climate crisis, but also of the interlocking systems of oppression that actually cause the climate crisis. So it's not just about the weather, it's not just about the environment, it's about the systems of colonialism and capitalism and white supremacy that are causing climate change and also contribute to so much loss. And I think of that loss as political loss or political grief that goes hand in hand with climate grief. So that's kind of an abstract definition. What does it actually look like? What form does it take in people? What does it feel like? My participants were, there was 9 participants aged 18 to 30, and they all had experience a year or more of climate organizing and activism. And in our workshops that I ran and in the narratives that they wrote about their experience, there was kind of 6 themes, emotional themes that arose. And 2 of the ones that kind of were on the surface were these feelings of anxiety and fear and dread, and then feelings of anger and bitterness. And kind of below those feelings were some deeper feelings that took a little longer to arise, but feelings of guilt and inadequacy, of powerlessness, and then feelings of sorrow and hurt were all really present in different ways in different people. And lastly, there was kind of this like dynamism or swinging between the feelings of hopelessness and despair, but then also these feelings of determination and purpose and hope. And in some people, these kind of coexisted side by side. Some people, they would move between the 2 at different points. And so I think all of these emotions are significant to acknowledge. Grief can look like so many things. Any emotional response is valid. To actually like communicate the depth of these emotions, just listing the emotions doesn't really do much to like help us connect with the actual feeling. So I'm going to read out a poem that it's a found poem. So I constructed it as part of my research process. Each line is a phrase from from a narrative of one of the participants. So I selected different phrases and then combined them to create this poem that is trying to capture some of the themes that arose in their narratives. So I'll read it through for us. To grow in understanding is to hurt more. I've lived only 18 years, and right as we write, the world, a buffet in a gas station in Nevada, is having a heart attack. Economy crashed, the world collapsing, money wasn't real. It didn't make sense to use oil, and in retaliation, they still traded it, even there on the ocean floor. I got so mad, visceral, leaning out of a helicopter with a megaphone yelling. I guess children don't understand lobbying. We came home and I couldn't cry for months. To fight a fight that feels as if it has been lost hurts. It's kind of heavy. There's a lot of heaviness to these workshops. It's hard for me to read at some points, actually. The participants were all friends of mine and people I had organized with, and it was hard to hear the like grief that they had and the depth of it, and know that I couldn't, take any of that pain away. And something significant in this poem that is relevant for this conversation about climate grief and healing, collective healing, is the second last stanza. We came home and I couldn't cry for months. Despite all of these emotions that I just went through and the heaviness of them, lots of the participants said they actually felt numb a lot of the time and didn't have access to a lot of those emotions. And maybe some of us in the audience, or all of us probably, can relate to that, those feelings of numbness. And participants also talked about not having space to express those emotions. And in researcher terms, that's because climate grief is a form of disenfranchised grief, which means grief that's not recognized or supported by a society. So because there weren't very many spaces, some people did have access, but for the most part, there weren't spaces for participants to express these really heavy emotions that they had. And as a result, they had to deal with them on their own. And the way that they learned to deal with them was to numb them. And numbing is actually a very adaptive, healthy response to some degree in a grieving process. It helps us accept loss gradually instead of all at once. But if we're stuck in a place of numbness, the grieving process is stalled, and it can be really painful and unhealthy in the long term. So that leads me to how do we get past that numbing? What happens when you bring these emotions into a group setting? What does that look like? And why is it important to do that? So the context of this is in the workshops, I had participants write narratives and then share them with one another. And then we also had what were called grief circles, where everyone had a turn to just share whatever was on their heart in that moment. And they were kind of reassured before that sharing that anything that they came up with, anything that they brought to the group would be respected and would be held. And the result of this was really profound. It ended up creating what we call a container. As grief researchers or people working with grief and loss, they talk a lot about containment and creating containers. So in this case, the workshop and the grief circles created a structure or a container. And it actually allowed people to break through that numbness that they had coming into the workshops. One participant said, I feel like I've been kind of numbed out for a long time. It was good to get through that shell and to feel something. So I really visualize this container of the workshop as a structure that can hold us. And in the container are individuals with their own little shells of numbness that have allowed them to contain their grief and to hold their emotions and control their emotions on their own. But as soon as there's a larger container that's holding them, that shell can actually break apart and the emotions that were blocked in them can move. And for people to talk about grief as being a watery emotion or a watery process, it needs to move and it needs to flow. And the workshop container holds the edges of that and allows the movement to happen. But this is a really hard, can be a painful thing to happen. There's a reason we numb emotions. It's because it's disorienting and hard to feel the intensity of grief. Another participant said, I've been pushing these emotions away and I didn't even know until we sat down today. I'm feeling overwhelmed in a good way, but also in a really bad way. And this same participant, he talked about a tidal wave of emotion. So it's like his shell kind of broke open and he had no idea what the depth of what was there. And he felt overwhelmed by this tidal wave of grief. And he says, it felt scary and bad, but then also this feeling of there was something good about it, something right about it. And I think that really defines the grieving process, that it's painful, but there's something that feels really good about it. And I think that good feeling comes from knowing that your pain is being witnessed, or someone is present to your pain, you're present to your pain, and then this group of people is also witnessing and being present to your pain. It's a way of honoring that pain. So one participant really touches on why it's so important, what this presence looks like in a group. She said she was talking to a participant who shared before her in the grief circle, and he was really vulnerable and he actually cried and was really open. And she said to him, I want to say an extra big thank you. I feel like you being vulnerable has been a model for me. I feel really blessed, really thankful to have witnessed that and to have it hit me as well. So she touches on this, that it was actually her bearing witness to his pain that allowed her to have her own pain come up and be manifest. And I think of it as, all of the individuals in our little shells in this bigger container, once the shells have cracked open, even just a little bit, they don't have to totally unravel, even just cracking those shells a little bit and having our pain move, it helps us realize we don't carry our pain on our own. And it leads to this movement of pain, of grief, and of compassion between people. And the result of this, that movement, is these deep experiences of connection. And the word connection came up again and again when participants were reflecting on the workshops and what they meant to them. They talked about feeling really more connected to themselves, getting through that numbness and feeling connected to their deeper emotions. They talked about feeling connected to others and then to something bigger beyond the workshop. One good quote that kind of exemplifies this, a participant said, "I felt deeply connected to other people in the workshop. It was interesting to see a lot of us shared the same purpose for organizing, which was deeply rooted in grief." So this points to the fact that she felt connected to the other participants, but she also, as a result of this grieving, felt more connected to her own purpose and then to a bigger shared purpose. And this was significant. This was a significant finding actually of the research, is that the participants who talked about feeling connected to something beyond the workshop, whether that was a shared purpose or feeling connected to the earth. Some talked about feeling connected to a love of the land. Some talked about feeling connected to a bigger community. Some talked about a connection to the project of liberation, like the global project of liberation. They were the ones who also talked about feeling more resourced and more prepared to face the pain of loss going forward. And this is really important, for all of us who are going to, in our futures, face loss in our life. But it's especially important for people kind of working in the field of climate, or people just wanting to come to terms with the reality of the climate crisis and what it means for them and their kids and their family and their community. There's going to be loss. Like there's a level of loss that's locked in at this point in the climate crisis, and it's inevitable. And so for these participants to get to a place where they can accept that and keep moving forward and keep organizing or doing their activism work, even though they know, like that poem said, they're fighting a fight that's already been lost in a lot of ways. And that's a really difficult thing, I think, to come to terms to emotionally. But this grieving process helps us do that and allows us to keep going, even though we know there's more loss ahead of us. And essentially, like what this means, I think, for all of us, whether you're an activist or not, is that we can't heal alone. We're not able to process the weight of this, the devastation of the climate crisis or of so many other losses in our life. We can't do it alone. We do need each other. And it becomes a question of what is holding you? What container do you have that can allow you to grieve? And then in the grieving process, you actually deepen your connection to that container, and it allows you to continue on and face loss and continue grieving. I think of grieving as a way of living fully. And so what is holding you can be like your own body, it can be your family, it can be your community, it can be the land. We're going to have presenters after this talking about that connection to land and accessibility to it. And so my hope for all of us is that we can find or continue regular practices, because we do need to practice this connection and the feeling of being held. We live in a society that constantly tells us we're separate from everything. So my hope for all of us is that we can continue to find those the things that hold us and remind ourselves of those deep connections, so that we can gradually face the reality of what's coming and what's already happening in terms of the climate crisis.
I'm wondering, for people who are particularly feeling isolated or not sure what's the first step to go and find a container, where do you recommend that people start?
Yeah, that's a good question. And I think we are all feeling isolated, especially during the pandemic and in so many ways. I'd recommend, deepening connections that are already there, ways that in the past, if you've had moments that you've felt a deep sense of belonging, whether it was like in a natural space or whether it was with friends or family or whatever the context was, like reflecting on what were those moments in your life and how can you continue to foster them and cultivate or reconnect with some of those containers, I think now. A big thing for me that has like provided so much life and support has been connecting to ancestors. I think it's something that's deeply prevalent in a lot of cultures, but not in Western culture. So that can be a really beautiful way, I think, of finding containers.
You briefly touched on this, and I appreciated your honesty too. I feel like sometimes when we talk about eco-anxiety or climate mental health, one of the words that's often brought up is hope and the connection between hope and action. But what you bring up is that word grief is sort of missing there. And so I was wondering if you could comment on the connections between hope, action, and grief.
Mm-hmm. Yeah, that's a good way of putting it. I do feel like the word grief is missing from a lot of the discussion. And I think because we're uncomfortable with the pain of grief and we want to jump right to hope. And I understand why it feels like a safer place to be. But there is this necessary, when I talk about the wateriness or the unraveling that happens in grief, there's a necessary process of letting things fall apart in a way so that we can rebuild. And that rebuilding process is a process of hope. It's a process of recognizing the reality of loss and saying, even though that's real, and I know that now that I've grieved, I know it's real, there's still a reason to keep going. But you can't skip that process, or you can, but it'll catch up with you, essentially, I think. Yeah.
That was a very impactful line in the poem, to fight a fight that feels like it's been lost, but to actively keep going, like that really is hope. Yeah. And you work as a climate chaplain. I'm wondering, I feel like sometimes there's misconceptions of being of a certain faith and the politicization of environmentalism. Has that manifested in your work at all, or how do you work against dismantling that misconception?
Yeah, it's interesting. There's people that are really receptive to kind of faith-based perspectives and beliefs and how those relate to the climate crisis and climate justice. And then there's definitely a lot of mistrust. And my own tradition that I come from is Christianity. And like so much of that mistrust is understandable, right? And has good reason. So yeah, there's definitely some preconceptions that I can work against, or can people have a lot of ideas of what Christians believe or how we behave, but for the most part, I found people, I think, more and more receptive, especially actually younger people who have realized that like politics, at least the way it's being presented in the mainstream, and even science, isn't providing them the explanations on a deep level of meaning that they're longing for, right? And I think spirituality, that's where spirituality and religion and storytelling and art, that's where those come into play. They can really help us connect to things on a deeper emotional level that sometimes, political scientific views don't get into that same depth in the same way.
Well, that's all of the questions that I have for now. Thank you so much for joining us today. And I'm sure we might have some more questions from the audience, and we'll be able to relay those to you at a later time. But did you have any final comments before going that you feel like people need to know this, or something that's impactful to you in your life when it comes to climate healing?
I think it looks different for everyone. I think some people have a really intense experience of climate grief where they go through this period of deep despair. And that's really painful and hard. But it also, I think, actually opens up the opportunity for this like dramatic reconstruction process that's really powerful. Other people don't have that same dramatic experience. And I think, it's different for everyone. But you can't do it alone. I think that's the biggest takeaway for me in my own experience of grief and in working with others. And it's so deeply meaningful and fulfilling to go to those deeper places with people. It's so difficult, and it takes intentionality, especially in our culture. But yeah, I would recommend everyone, like, if you can, intentionally maybe engage people you love in conversations around this, or watch a film or read an article together and talk it through and see what comes up from that. And yeah, even if there are lots of still feelings of numbness, whatever is coming up, or resistance, like, it's all part of the process, and it's all okay.
Thank you, Gabrielle. And if anyone has questions as we go along, please don't hesitate to put them in the Q&A function at the bottom. Our next guest today is Jenny Mccaff, an educator, facilitator, and project manager specializing in strategic initiatives with nonprofit organizations. Her collaborative work with provincial and federal governments, school districts, and industry groups aim to change behaviors and empower people to protect the environment. Jenny is the Director of Learning and Engagement for the Invasive Species Council of BC, and today will share with us her work with the BC Parks Foundation launching the Healthy by Nature initiative. Thanks for joining us, Jenny. Please go ahead and start your presentation.
There we go. Thank you so much. I'm so grateful to be here today. Thank you for having me. I am joining you today from the unceded territory of the Squamish, Tsleil-Waututh, and Musqueam nations here in East Vancouver, and hopefully I can maintain a connection because it is very stormy in my little neck of the woods here. So I'm really grateful to be a part of this, and just so fascinated by Gabrielle's presentation. That was really powerful, and I want to continue on that and talk a little bit about how we feel when we're outside in nature. So what I'm going to get everyone to do, and actually I'm going to bump back a few slides here, but I'm going to share a link in the chat, and we're just going to do a quick word cloud. I want you to all think for just a minute about how you feel when you're outside in nature. And I'm going to have you use one word. If you've got a couple more, that's fine too, and pop them into this word cloud, and we'll see what we get. So I'm just going to enter that into the chat right now. So you can click on the link and then enter that code, and I'll bump us back to, I have to stop showing and just change my screen. Sorry about that, everybody. All right. So hopefully everybody can access that link. You can use it, do it from your phone, you can do it from your computer. And we should start to see a few words popping in here, I hope. If we don't, I'll move on. That's okay. We're getting some into the chat, which is fabulous. Oh, Luke, thanks for sharing that. Okay, well, I'm gonna stop sharing the word cloud. I'm gonna bump back to my other word cloud, and I'll share that afterwards. Right. So I want to talk about parks prescriptions. Dr. Melissa Lum will continue this conversation along after me as well, but I'm going to talk a little bit about how it all started. So we shared those words, and these are a couple of examples I just thought I'd include from other presentations that we've done. These are some of the words that seem to keep coming up. So you can see calm, peaceful, grounded, happy. These are the feelings that tend to come up when people are outside in nature. And I'm sharing this now with you because we're going to talk a lot about the evidence behind the Parks Prescriptions program and Healthy by Nature. But I think it's really important to recognize that this evidence has come from something that we know and we can feel when we're out there ourselves. And it's about giving other people the permission to feel this way, the permission to take that time. So Healthy by Nature is an initiative that was launched by the BC Parks Foundation in 2018. And it came from the recognition that there was really a gap in that health nature connection. And we felt like it was so important to try to start closing that gap here in BC and across Canada, for people's own personal health, but also for the health of the planet. So the goal was really to get people outside more often, to enjoy nature, benefit from green time. And the really fabulous thing about getting people outside more often is that generally outside and nature start to benefit from that time as well, because people who have those strong connections to nature end up wanting to protect that space, those places that they're in. So at the same time that we launched Healthy by Nature, we were incredibly lucky that Canada's Chief Public Health Officer announced that access to active play in nature and outdoors is essential for healthy child development. So that was really great opportunity for us to kind of build on that, again, coming from that place of health, personal health. So our goal was to really build a lifestyle, to build a community, and just get outside and unplugged. So the goal was to create a social norm in the same way that I imagine every single one of you puts on your seatbelt every single time you get in a car. And I'm sure you brush your teeth before you go to bed. And when you wake up in the morning, you don't think about it. It's not something you have to add to your list. It's just automatic. This is how we want people to view time spent in nature. It should be automatic. It should be every day. It should be a non-negotiable. So the Parks Prescriptions program was a key piece of that Healthy by Nature to provide that evidence, to provide, really a grounded place coming from a place that everybody goes to their doctor. In general, it's a trusted source of information. So our goal from day one was to see this nationwide. We wanted to help all sorts of communities and individuals get these health benefits. And we really wanted to see an increase in outdoor recreation, and along with that, environmental stewardship, so that we could protect, maintain, and even grow our parks. And this is a fascinating piece because this came together obviously in a pre-COVID world, and what we did see around the world in those early days, and it seems to have been sustained, is an increase in outdoor recreation. That was a safe place to be, something that we could do, and people went outside. That's what they did. Here in BC, certainly we were so lucky to be able to get outside and have access to these green spaces. But what we didn't necessarily see go along with this was the environmental stewardship piece. And so that's something that is being built into the future of the program, because it's obviously just as important as getting outside. So I'm going to fly through some of these examples of some of the Parks Prescriptions programs in the US. And that they were the foundation for a lot of the research that went into the Parks Prescriptions program that we built here in Canada. And I just include this, I know it's a little bit fuzzy here, just for two reasons. Looking at the growth in the bottom right-hand corner of the Parks Prescriptions movement in the US, it has grown quite quickly, but I'm thrilled to say that it seems to be growing a lot faster here in Canada. And we have over 1,000 prescribers across the country right now that are healthcare professionals. And that's not just physicians, as you can see on the bottom left there. This is in the US, but it's similar here. We're really hoping that we will see all sorts of health professionals prescribing time in nature. I always include this slide for a number of reasons. One, I really love how they've created this pyramid of priorities. So getting outside daily, and then maybe those bigger trips weekly or monthly or annually, because I think it's important to recognize that we are not suggesting in any way that to get the benefits, the health benefits of time in nature, that you have to go and do a week-long backpacking trip in the middle of nowhere. That's not at all what we're getting at. It's that daily piece that's easy and that you can incorporate into your life. And I think an important piece that goes along with that is recognizing that nature is what you make it. And if you are out in your back garden in a little plot or on your balcony with your little tree, and you feel like you're in nature, then you are in nature. And so that is reflected in the research too, which is really fascinating to me. The other reason I include this one is that the Shift RX Challenge, they hold a conference every year. And I was talking with one of the CEOs of the Blue Cross Foundation in the US, and she had said that she had participated in this in 2018. And she met a really interesting man sitting beside her, and they had a great chat. So she looked him up on LinkedIn. When she got back to her room, couldn't find him. So Google, Facebook, Instagram, nothing, was not online. And so the next morning when they were at the buffet or whatever you used to do in conferences, she said, I couldn't find you online. And he said, well, I'm not online. I'm with Homeland Security. And we're concerned that the next generation of kids is not mentally and physically prepared to serve their country in the Army because they haven't had enough time out in nature. So that to me was just a really fascinating anecdote that I've been impacted by for sure. So we've started the Parks Prescriptions program with physicians as the audience because they're in this unique position as a trusted healthcare provider. They have this ability to follow up and to talk to their patients and to promote behaviors that improve health and well-being. So we talked to a lot of physicians, we surveyed them, we ran some focus groups, and we found these key barriers around actually prescribing time in nature. So, we could talk about billing, and I think that's been overcome. Evidence was number 2. And again, that's a really, Melissa will talk a little bit more. She'll talk a lot more about the evidence, but also about where you can find that evidence, because that is growing and growing each year. And so that's been really powerful to see as this program goes on. So this is just a quick example of what a prescription looks like that we provide to physicians. I'm showing this because I think that it's really important to note that this is a plan that you create with your physician together. And it is shown to be far more likely that you'll actually do it if you're involved in that planning and in writing that down. So we'll talk about prescriptions a little bit more after too, but this is just some of the marketing. These are a couple of the posters, one that would, for example, be in the waiting room at your doctor's office, and one that would be in their lunchroom or something. And just some of the top examples of ways that time in nature can improve your health. So for us, the Healthy by Nature program and Parks Prescriptions as a piece of it was so important because of this evidence. We wanted this to be very much grounded in evidence for adults, for kids. We'll talk a little bit about where you can get these fact sheets too. Melissa will talk about that too, and how to maximize your prescription. So I'm going to let Melissa continue on with this conversation unless there are questions, Anari, but thank you very much for having me.
Thank you, Jenny. Our final guest today is Dr. Melissa Lem, a Vancouver-based family physician and president-elect of the Canadian Association of Physicians for the Environment. She has been researching, writing, and speaking about nature-health connections for over a decade. And along with being a clinical assistant professor at the University of British Columbia, Melissa is the director of the Parks Prescriptions program. So please go ahead and start your presentation, Melissa.
Thanks so much, Anari. It is, Jenny and I have done a lot of different presentations, and this is the first time we've been in one where the topic of climate grief has been discussed in such an in-depth way. And it's really meaningful for us to be part of this work and part of this circle of conversation. So as you mentioned, I'm Dr. Melissa Lem. I'm speaking to you today from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations in Vancouver here. And I think, Oh, actually, I think this is not my first slide. Sorry, I don't know how that happened. Anyway, and I think a major reason why it's so important for me as someone who has been a nature and health advocate for so long, and also like a fairly newcomer to the climate movement, is because connecting to nature and spending time grounding yourself and being in the moment when you're spending time in nature, it really goes a long way towards supporting our mental health, improving our resilience, and then again, really fostering those connections that lead us, that inspire us to protect nature, and then also engage in other pro-environmental behaviors, as I'll speak about. And I've really found, for the longest time, I have to say that, I stayed in kind of my nature and health box, and I thought, like, what am I doing for the climate movement? That's becoming so important to me. And just through meeting other people and learning about the research behind how connecting to nature can make you such a powerful climate advocate, both kind of helping you adapt, build resilience, and then also motivating you, I think has really given me new energy to this work. So thank you for coming to our talk today. So you can think about nature prescribing as sort of a subset of social prescribing, and that's really when physicians and other healthcare professionals connect their patients to social services or kind of resources in their community to improve their health. And the reason why this is so important is because our healthcare, which you can see there, it only makes up about 25% of our health status. And there's so many things outside of our healthcare that actually make us healthy. And by connecting to nature, as you can see in many of those different words, many of those different categories on the right-hand side, this can actually go a long way towards improving many of these outcomes on the right-hand side. So what we do in the healthcare system is important, but really so much of what happens outside is much more important when it comes to our health status. And these are just a couple of different infographics that speak to the many, many health benefits of nature. And I would say one of the areas of study that is best developed with the study of the health benefits of nature are the mental health benefits. So, but as you can see, spending time connecting to nature and near nature can improve your bone density. It can relieve pain, enhance your immune system, reduce your risk of chronic cardiovascular type diseases, reduce stress. It improves ADHD in kids, pain scores after recovery from surgery. It improves your work satisfaction. So kind of across the board in terms of physical and mental health, there are a huge number of benefits, health benefits to connecting to nature. And we know that when our bodies feel healthier, our brains are healthier too. And so I just want to get into some of the research behind why nature is so good for us. So I'm going to share some of my favorite studies. This one is one that was done right here in Canada. It was a study in Toronto, and they combined high resolution satellite imagery, individual tree data, Ontario Health Study data, and self-reports of health perception. And what they found was when they controlled for different socioeconomic factors and crunched the numbers was that having 10 more trees per block actually improved people's health perception, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year, higher median income, or being 7 years younger. So we know that age plays a big role in our overall health. We know that our income plays a big role in our overall health. So I think it was really neat how they brought it down to the level of tree cover and things that we know improve people's health. So anyway, that's one of my favorite studies to share. Here's another one that I like because it speaks to nature as medicine. So this was a pilot study that was done with 17 kids with ADHD in Chicago, and they guided them on 3 20-minute walks through a city park, through a downtown area, and through a residential area. And what they found was that a 20-minute walk in the park improved their digit span backwards performance, similar to levels in kids without ADHD. So you can see this bar on the left-hand side here is significantly higher in terms of the score than the park walk, than the neighborhood and downtown walk. And digit span backwards is exactly what it sounds like. You recite a bunch of numbers in a row, and then you ask the study subject to recite them back to you in backwards order, and the more they can recite accurately, the higher their DSB score. And that's kind of like a test of sort of like math and recall and attention. And so they found that in fact, that 20-minute walk in the park improved those DSB scores, similar to the peak effects of Ritalin, which is a prescription stimulant medication. Now, no one is saying that a walk in a park is going to replace all the different things that stimulant medication does, but I think it really speaks to how powerful nature can be as an adjunct for our brains, for our brain health. So I'm just going to get you to think to yourselves and maybe put in the chat. what your thought is about this question. So people report significantly better health and well-being after spending how much time in nature per week? Is it 1 hour, 2 hours, 3 hours, 4 hours, or 5 hours? So what does the research say? If you just put that into the chat. I'm seeing some 4s and 3s and 1s and 2s. Maybe more 1s. Okay. So this is a really interesting question, because really there is some research that just spending 5 minutes in nature can improve certain markers of mental health. But when it becomes, so this was a study that came out in 2019, right around the time when we were starting to devise this program and our recommendations. And it was a study of almost 20,000 adults in England. And what they found was, when they asked them how much recreational time they spent in nature per week, and again, after controlling for different factors, their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 120 minutes or 2 hours per week. And those benefits continued to build up until about 200 to 300 minutes per week, and then it sort of leveled out. So this is why in our program we have this standard recommendation that people spend at least 2 hours in nature per week to kind of get those significant health benefits. And it's really handy if anyone here is also a physician or in healthcare, because the recommendation for physical activity per week is 2.5 hours. So if you can think about spending a lot of that time when you're naturally more active in nature, you'll get additional benefits over and above exercise. Here's another question for you to answer, to put the answer to in the chat. So this speaks to dose, like how big should your nature pill be? So the most efficient drop in cortisol levels happens between how many minutes in nature? Is it 5 to 10, 10 to 20, 20 to 30, 30 to 60, or 1 to 2 hours? What do people think? Okay, I feel like the majority of people answered 10 to 20 or 20 to 30. And the actual answer is 20 to 30. So this was another study that was done in 2019. And what they did was they asked 36 urban dwellers over 8 weeks to engage in a nature experience in an outdoor place that brought them a sense of contact with nature. And again, it didn't have to be in the backwoods. It didn't have to be up a mountain or somewhere where no one else was. It was self-defined, which I think Jenny spoke to. There is other research actually showing that what can matter with your nature experience is that you feel like you've had a nature experience. So they asked them to do this at least 3 times per week and for 10 minutes or more. And they found that their cortisol or stress hormone levels dropped over 20% more after a nature experience compared to a non-nature experience. So if you look at the chart here, at the graph here, you can see this third little broken line here is between the 20 and 30 minute mark. And that's when their stress hormone drop, the drop was the steepest. So if you kind of, we're very busy, a lot of us live in cities, a lot of us have a lot to do. So if you kind of want that most effective nature pill, try to spend at least 20 minutes in nature. Between 20 and 30 is ideal, but the more the better, because your cortisol levels continue to drop, but it's fastest at the 20 and 30 minute mark. And again, people often wonder, like, why is the BC Parks Foundation, why are they getting into this business of nature prescriptions, right? I mean, they're focused on kind of like healthy land and kind of conservation. And it's because health is an incredibly effective message to motivate people to do conservation friendly and also climate friendly things. So we can take some of these lessons from climate change research. I've actually updated this slide because there's some neat research out there, but this is a new study that I really like. And so they did surveys with over 7,500 participants in 5 countries, the researchers here, and they asked participants to read 5 pairs of statements and asked them which one of the 2 would make them more likely to support policies tackling climate change. And they found that when they framed kind of like the benefits of acting on climate change in terms of health and environmental framing, this actually increased support for these policy changes. Interestingly enough, for the average person, framing it in terms of benefits to the economy really had no effect. And in fact, positive or opportunity style framing, like if you do this, these good things happen, actually increase support for these policies more than threats, like if you don't do this, this bad thing will happen. And they also found that focusing on current impacts was more motivating for people than future impacts. So when you think about our park prescriptions program, the fact that we focus on current health impacts and we focus on it as a very positive thing, really could be falling in line with this, with these lessons that we learned from climate change research in terms of how to really maximize and make our messaging most effective. And finally, in terms of the presentation of the research, I'd like to talk a bit about why connecting to nature is good for the planet. So we know that healthcare is a major contributor to global carbon dioxide emissions. If healthcare were a country, it would be, if global healthcare were a country, it would be the 5th highest emitter in the world. And within Canada, we emit about 5% of our total greenhouse gases, which is similar to the aviation industry, which I think is pretty stunning. So we have some work to do. But conversely, anything that we do to improve people's health status will reduce those greenhouse gas emissions and reduce warming. Also, there's a huge amount of evidence showing that urban nature makes cities healthier. So not only with street trees reducing the urban heat island effect, or kind of more healthy watersheds or more healthy kind of lake and oceanside ecosystems buffering against flooding. But we've just heard about how having more access to nature improves human health. So it's kind of like a win-win in terms of infrastructure and also improving human resiliency. And also, as Jenny mentioned, kids who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And it's not only that we protect what we love. There is research showing that people who are more connected to nature are more likely to engage in more pro-environmental behaviors overall, going beyond conservation. So from saving electricity to recycling more, to even engaging in political advocacy. So I like to think whenever I write a prescription for nature, or whenever one of our over 1,000 prescribers writes a prescription, we're in our small way doing our bit to fight climate change. And I also like to point out that the executive director of the UN Environment Program has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So when we think about the fact that health is such a powerful message, and if we can kind of get health professionals behind that message that we need to conserve nature, that we need more nature for people to connect to, I think this could go a long way towards convincing governments and convincing decision makers that we need more nature and we have to conserve it more. So this is our website, which I'd encourage you to visit. I think it's quite beautiful and full of nature photos, which will be good for your mental health, and also lots of kind of concise and practical information on how to maximize your nature prescription, whether you're a patient or a prescriber. And I think Jenny showed we have customized nature prescription files that if you're a licensed healthcare professional, we'll send you a customized nature prescription file that you can use to start prescribing nature. And then we have 14 different fact sheets broken down by different health issues, one of which you can see on the right, that can help you both think about the different conditions that spending time in nature or around nature is good for, but also to kind of inspire patients to want to do it more. Because if they see, wow, these 5 different research studies really indicate how good spending time in nature is for my diabetes or for my respiratory health, it might just motivate them more. And that's my final slide. Thanks so much for listening.
Thank you, Melissa, and thank you, Jenny. Very interesting work going on through the BC Parks Foundation. I have a question as the audience kind of inputs theirs. Something that I grapple with when spending time in nature, especially given the colonial history of parks, is how can we connect to a land in a way that sort of changes that relationship or makes people question how they can engage with the land or waters to decolonize that relationship. And do either of you have a comment on that?
Go ahead, Jenny.
No, it's okay. Sorry, we both unmuted. Go ahead.
All right. I think that is such an important question, and that often comes up as a criticism, actually, I have to say, of our program. It's like, well, you're sort of kind of appropriating or kind of stealing this idea that the land is important for our healing. And this is something that Indigenous peoples have thought for time immemorial, right? And still practice today and still really hold as important today in their culture. And so, I mean, one thing I would like to say to that is, I would say every single culture across the globe really values nature, like from its infancy. It's something that's uniform to every culture, I would say. But I would also say that Indigenous peoples today have more of a connection to nature overall in their culture than many of us who have our cultures have moved forward. So, so in terms of that question, I just think it's important to bring more Indigenous voices into these spaces to talk about them. Recently, at the Canadian Association of Physicians for the Environment's Climate Emergency Conference, I was, acutely aware that a lot of the talk in this area happens to be from kind of like academics and like, settler academics and settler health professionals. And so I really wanted to bring forth the voice of an Indigenous researcher who's been doing some really powerful research and connecting of people to nature, or to the land, actually would be the term, in Yellowknife, for example. So I just think listening to Indigenous voices and incorporating kind of this idea that we're not separate from the land, that we are actually the land ourselves. So like, how can you actually go out onto the land when you are the land? And just really, bringing those voices forward is a really important part of decolonizing this entire pursuit.
Yeah, for sure. It is a big question. So thank you. It's hard to sort of wrap up in one sentence, right? It's huge. But I think building on the idea that Gabrielle brought up of nature as a container for healing when it comes to eco-anxiety and climate mental health, I loved how you both touched on how nature is sort of what you perceive it to be. I'm wondering, for people who feel or who are in positions of not having as much privilege when it comes to time or resources or finances, how can people engage in connecting with nature in those situations?
That's a great question. I'll kick off because it's absolutely true, and we saw some of those images from Melissa. I mean, the neighborhoods that are more affluent than others tend to have more nature than others as well. So I think in British Columbia, we're incredibly privileged to be in a position where everybody who lives here is very close to some aspect of nature. And I am not suggesting that everyone, has access to go, hiking in the mountains every week. I mean, there's so many different barriers, but I think that in British Columbia, we all can walk a few blocks and we'll reach a city park that can act as that nature space or community garden. There's a lot of different options there. So in British Columbia, I think that we're quite lucky to have that type of access.
Melissa, we have a question from one of the audience members, and they're wondering, do these prescriptions help people get time off work who may otherwise be too overworked to spend those critical 2 hours a week in nature?
That's, again, a really interesting question, because it's something I never thought of. I don't think of it as kind of like a sick note. I think of it as like a wellness note, right? So it's something, like Jenny mentioned, that we should really be incorporating into our everyday lives. And then on the weekend, or once a month, or once a year, having those deeper nature experiences. So that's an interesting question. But I like I said, it's not like an excuse from work, no, but just a reminder, really, that we need to prioritize it in our everyday lives.
Thank you. I am mindful of our time, but there's just one more that has come up, and I'm curious if you could both comment. You're in very different fields with some overlap here. So within the medical profession and also through BC Parks and non-government government work, how is eco-anxiety or climate mental health talked about, and where do you see that going?
That's a big question. I would say, personally, I'll speak from the perspective of the nonprofit side. I mean, I just think that is a conversation, that dialogue is happening all the time now. And so I think that that's just a really important piece. That's not dialogue that was happening 2 years ago in very many circles. And it's now happening almost in all of our work. So I think that that's a really important step forward as it is. I'll pass it to Melissa.
Yeah, and I mean, I can't say that in any sort of overt way I've ever counseled a patient who's presented to me with eco-anxiety. And I know there are people who are attending here who have, but just speaking from like a physician perspective, when I manage people, for example, like illnesses during the heat dome or during the smoke that filled our skies, I know that in fact, many of my patients who had been doing well with their mental health just decompensated at those times when that added layer of the environment on top of already kind of tenuous mental health just kind of tipped them over the edge. And so I think we have to be aware as health professionals and ready when those times come, like when we know the heat's coming, when we know the smoke's coming, to be extra, maybe even intentional, on checking in on these patients, on making sure they have the supports that they need, making sure that because we know a lot of this happens in the summertime, right? In BC, it's like the heat and the smoke, it's happening in the summer. Even though it's dark, in the wintertime or the fall, it's not like hot and smoky. So anyway, I think we just have to make sure that our patients are as resilient as they can be, to be ready for when these times come. And part of that, I think, really involves connecting to nature regularly, and prioritizing it in their everyday lives.
Thank you. I wish we had more time. There's so many questions that we could talk about, but if anyone has any questions that didn't get answered, I would encourage them to put it in the Q&A. But I just wanted to say thank you, Jenny, Melissa, Gabrielle, for your excellent presentations today. This is the tip of the iceberg when we think about climate mental health, eco-anxiety, and connecting with nature as sort of a container to healing. And it's clear that eco-anxiety and climate grief affects everyone differently. And at the intersectionalities of race, gender, class, sexual orientation, ability, those can sometimes compound as well. And so while grief should be included in this conversation with climate action, it's also important to focus on healing, joy, and resilience towards climate justice. So with that, we're going to end today's episode with our climate action recommendations for the week. First up, Gabrielle has shared some resources with us, and if you'd like to host a climate healing circle in your own community, we'll make sure to share those resources with you. And while feelings of anxiety are totally valid and can take some time to process, it's also important for us to reflect on our positionality at that time. What kind of resources or supports do we have that everyone might not have? And how can we sort of engage in grief, but also in healing towards collective liberation? So we'll share those resources with you. And secondly, it's great to see Western medical systems like Park's prescriptions helping people to be more mindful and intentional with spending time in nature. And Melissa, I love how you mentioned that cultures all over the world, this isn't something new. This is sort of in us from when we were born. And so I'd like to encourage people as they're spending time in nature to reflect about their relationships to that land. And is there a way to start decolonizing or learning about the places that you like to go and to be in nature? And finally, one of the ways that you can foster hope and joy and healing is through action. So as COP26 wraps up this weekend, I encourage folks to sort of learn what are some of the outcomes of that conference. And if you're watching from here in Canada and want to see some more tangible policy, 350 Canada has a petition out right now where you can put your name to encourage the government to put forth a Just Transition Act and to prioritize that. Our next episode is just 1 week away, so join us next Wednesday, November 17th. We'll dive into the world of Pacific salmon and two-eyed seeing using Indigenous traditional knowledge systems and Western science for fisheries management. This has been a total awesome experience being here with all of you today, and we can't wait to see you next week. Thanks for coming.